Ever passed a stone smaller than a grain of rice and felt like you were giving birth to a boulder? You're not alone. Kidney stones, though tiny, can cause some of the most intense pain known to humans. With the right blend of hydration, diet, lifestyle changes, and natural remedies, flushing out kidney stones can be a surprisingly achievable goal. So, if you're ready to say goodbye to those pesky stones and hello to a happier, healthier you, stick around. Alright, let's start with the basics. What exactly are kidney stones? Imagine hard, pebble-like deposits forming inside your kidneys. These stones are made up of minerals and salts that are naturally found in urine. When our urine becomes too concentrated, often due to dehydration, these minerals can crystallize and stick together, forming stones. These stones can range in size from a tiny grain of sand to, in some cases, as large as a golf ball. Ouch, right? Depending on their size and location, they might pass unnoticed or they can cause some serious discomfort. We're talking excruciating pain. Now, not all kidney stones are created equal. Just like there are different types of cars, there are different types of kidney stones, each with its own unique makeup and characteristics. The most common type is called a calcium oxalate stone. These often form when there's an excess of calcium or oxalate in the urine. Then we have uric acid stones, more common in people who consume a high-protein diet. Next up are struvite stones, often linked to infections and more common in women. And lastly, we have cystine stones, which are quite rare and typically hereditary. Kidney stones can be sneaky. Sometimes they hang out in the kidneys without causing any trouble. But when they decide to move, that's when the alarm bells start ringing. One of the most common signs is a sharp, intense pain in your back, side, lower abdomen, or groin. Another red flag is blood in your urine, which might make it look pink, red, or even brown. You might also feel nauseous or even vomit, have a persistent urge to urinate, or experience a burning sensation when you do go. And if an infection is present, you might even develop a fever and chills. If you experience any of these symptoms, especially the severe pain or blood in your urine, it's crucial to see a doctor immediately. So, what causes these troublesome stones to form in the first place? Well, it's often a combination of factors. One of the biggest culprits is dehydration. When you don't drink enough fluids, your urine becomes more concentrated, creating a prime environment for those minerals to crystallize and form stones. Diet plays a major role too. A diet high in oxalates, found in foods like spinach and almonds, protein and sodium can increase your risk. Certain medical conditions like gout, urinary tract infections, and digestive diseases can also contribute to stone formation. And let's not forget about genetics. If you have a family history of kidney stones, you're unfortunately more likely to develop them yourself. While many people can successfully pass stones naturally, there are situations where medical intervention is necessary. If the stone is too large, we're talking bigger than 5 to 7 millimeters, it might be too big to pass through the urinary tract on its own. Similarly, if the stone is causing a blockage, preventing urine from draining properly, surgery might be the only option. Severe pain that can't be managed with medication or signs of an infection also warrant immediate medical attention. Remember, this video is for informational purposes only. It's crucial to consult with a healthcare professional for personalized advice and treatment. Now, for the good news. Many people can safely and effectively pass kidney stones at home without the need for invasive procedures. If the stone is small, less than 5 millimeters, and you're otherwise healthy, there's a good chance you can flush it out naturally. It's especially promising if you're able to stay well hydrated, which helps to dilute your urine and encourage the stone to move. But remember, it's always best to consult with your doctor to determine the best course of action for your specific situation. Let's talk about natural remedies for flushing out kidney stones. Water is your best friend. Aim for 2.5 to 3 liters daily. Add lemon juice to your water. Citric acid helps prevent stones. Apple cider vinegar, or ACV, contains acetic acid, which may help dissolve stones. Now let's venture into the world of herbal remedies. One such herb is Chanca Piedra, also known as stonebreaker. This South American herb has a long history of traditional use for dissolving stones. You can find Chanca Piedra in supplement form or as a tea. Another herbal ally is hydrangea root. This plant has traditionally been used to support urinary tract health and may help prevent stone formation. Goldenrod is another herb that's often recommended for kidney health. It has anti-inflammatory properties that may help ease discomfort associated with stones. As always, it's essential to talk to your doctor before incorporating any new herbs or supplements into your routine. You might be wondering, do these natural remedies actually work? And it's a fair question. For example, studies have shown that lemon juice can increase levels of citrate in the urine, which can help prevent calcium oxalate stones from forming. Chanca Piedra, the stonebreaker herb, has also been studied for its potential to dissolve stones. And when it comes to apple cider vinegar, while more research is needed specifically on kidney stones, some studies suggest that it may help to alkalize the body, which could be beneficial for those with uric acid stones. Let's talk about the power of food. What you eat can either fuel kidney stone formation or help dissolve them. First up, we have citrus fruits like lemons, oranges, and limes. We already talked about how citric acid is a rock star for preventing stones, and these fruits are bursting with it. Next, fill your plate with leafy greens, especially those low in oxalates like kale and collard greens. These nutritional powerhouses are packed with vitamins and minerals that support overall kidney health. Whole grains are another great addition to your diet. They're not only good for your heart but also for your kidneys. And don't forget about fiber. Fiber-rich foods like beans, lentils, and oats act like little brooms, sweeping through your digestive tract and helping to minimize the absorption of stone-forming substances. Just as there are foods that help dissolve stones, some can make matters worse. Foods high in oxalates like spinach and beets can contribute to stone formation. High sodium intake and red meat also increase your risk. Finally, avoid sugary drinks. They can wreak havoc on your health. Supplements can support kidney health and prevent stone formation. Magnesium citrate binds to oxalate, reducing absorption. Vitamin B6 lowers oxalate in urine. Omega-3s in fish have anti-inflammatory properties. Probiotics may help break down oxalates. Consult your doctor before starting supplements. Flushing out a kidney stone is a great first step, but let's talk about how to prevent those pesky stones from coming back. Hydration is key. Drink plenty of water daily. Aim for at least 2.5 liters per day. Incorporate more plant-based proteins. Enjoy animal protein in moderation. Avoid crash diets. Focus on sustainable changes. Rapid weight loss can increase your risk. Consult your doctor about medications. There might be alternatives to reduce your risk. Let's debunk some common myths surrounding kidney stones and natural cures. First up, there's a misconception that only older people get kidney stones. The truth is, kidney stones are becoming increasingly common in young adults, often due to poor hydration and unhealthy diets. Another myth is that all kidney stones require surgery. As we've discussed, many stones can pass naturally with the help of home remedies, lifestyle changes, and a little patience. And finally, there's the belief that cranberry juice can help flush out kidney stones. While cranberry juice can be helpful for urinary tract infections, it's not effective for all types of kidney stones and might even worsen symptoms for some. Remember, it's always best to rely on evidence-based information and consult with a healthcare professional for personalized advice. So there you have it, a comprehensive guide to flushing out kidney stones naturally. The key takeaway is that you have the power to take control of your kidney health and support your body in getting rid of those pesky stones. Start by making hydration your new best friend. Seriously, drink water like it's your job. Next, incorporate kidney-friendly foods into your diet and limit those that can contribute to stone formation. Experiment with natural remedies like lemon juice, apple cider vinegar, and herbal teas. And of course, listen to your body. If you experience any severe pain or other concerning symptoms, don't hesitate to seek medical attention. So guys, we've covered a lot of ground today, but the main takeaway is this. You don't have to suffer in silence with kidney stones. By understanding what causes them, recognizing the symptoms, and incorporating natural remedies and lifestyle changes, you can take control of your kidney health and say goodbye to those painful stones. Remember, hydration is key. Drink plenty of water throughout the day and make friends with those kidney-friendly foods we talked about. Stay hydrated, stay healthy, and keep those kidneys happy.